So next we have Dr. Anna Malinow, who has helped us organize and came here all the way from California.
Well, hello, single payer people. Thank you so much for hanging on. Let's make some noise. What do we want? Medicare for all. When do we want it? What do we want? When do we want it? Everybody in? Everybody in? All right, I love that energy. Thank you, thank you. It's really great to be here. And before I get started, I really want to thank some individuals for making this happen. So March for Medicare for All started this planning many months ago. And I want to thank our wonderful MC, Savitz Joy. Thank you for this great effort. I want to thank all of our volunteers, and I'm going to forget some: Emily, Lauren, Ricky. Okay, so I'm forgetting already. And then I also want to thank Elizabeth, who worked so hard. Unfortunately, she wasn't able to make it. And we are here because of Elizabeth. So thank you so much, Elizabeth. I want to thank our ASL. Thank you so much. I want to thank all of our volunteers, the people distributing all the water. Thank you. You're making this a great success, and small gatherings have really been at the head of big change in this country. So my name, yes, is Anna Malinow. I'm a pediatrician. I am past president of Physicians for a National Health Program, and I am one of the lead organizers, thank you, for National Single Payer. We are a national organization of social justice movements just like yours, united by three non-negotiable demands. One, healthcare is a human right. Everybody in, nobody out. Say it after me.
Everybody in, nobody out.
Everybody in, nobody out. Two, healthcare must be free from corporate profit. Everybody in, nobody out. And three, healthcare can only be established through national legislation.
Yes.
Everybody in, nobody out. So let's go through our three demands. What does it mean when we say healthcare is a human right? Well, a human right starts at birth, not at 65.
Yeah.
A human right means we do not go bankrupt from medical bills. Healthcare is a human right means everyone, from conception to death, has the right to comprehensive, accessible, affordable, universal, gender-affirming, anti-racist, non-incremental, equitable healthcare for all. Now, do you think this is going to be handed to us? No. Are we going to have to fight for it? Absolutely. Now, second demand. What does it mean when we say healthcare must be free from corporate profit? Well, let me tell you that while we were busy organizing this march for Medicare's birthday, so happy birthday, Medicare, government officials this past week, medical professional societies like the AMA, academic institutions from Harvard to Stanford, and health policy think tanks, and over 30 corporations, publicly traded, investor-owned corporations, convened at a summit. To do what? Do you think that they convened to protect Medicare? Absolutely not. They convened to hand Medicare to Wall Street. Yes, absolutely. Now, don't let them fool you. They hawk value, they hawk accountability, they hawk equity, as if corporations that created the inequality in the first place could ever achieve health equity. So, you think that Wall Street is just going to give up? No way, no way. We're going to have to fight for Medicare for all. Now, demand number three. What does it mean when we say healthcare for all can only be achieved through national legislation? Well, should we leave Medicaid expansion to the states? Should we leave abortion rights to the states? Should we leave voting rights to the states? Should we leave healthcare rights to the states? Absolutely. States' rights have never moved this country forward. In fact, it's always moved us backwards. There is no incremental program that can ease us step by step, state by state, to the removal of the corporate powers and to private insurance companies. Private insurance companies, corporate profits must be removed from the system through national legislation. Thank you. This is our crisis moment. COVID-19 has proven how ineffective, inefficient, inhumane, and honestly, indifferent our healthcare system is. 1 million dead from COVID, 339,000 of which could have been prevented had we had a national health program. And I will tell you, all of us here today, we are going to be living 2.5 years less because our life expectancy went down by almost 2.5 years during the pandemic. But this loss in life expectancy was highly racialized. Blacks have lost 3 years in life expectancy, and Native Americans have lost almost 5 years in life expectancy. Is this fair? Is this equitable? Does this add value? No. Wall Street is not going to save us from this. And while Americans died, the 3 largest health insurance companies, let's call them out, United Healthcare, Humana, Anthem, saw their profits double. And the pre-tax profits of Pfizer, BioNTech, Moderna are how much? $1,000 per second. So since I've been up here talking, and I know that I'm going on, they've made $300,000. And how much are they going to make today to celebrate Medicare's birthday? $84 million. Today and tomorrow and the next day and the day after that, unless we stop them. Now we think this is normal. Well, breaking news. This is not normal. It's not normal to go bankrupt because you were uninsured during COVID. It's not normal to, it's not normal to go bankrupt because you were sick, and it's not normal to die from COVID because you were uninsured. And it's not normal to wait until you're 65 to get on Medicare. Where else? Where else? It's not normal to profit from other people's misery. This is American exceptionalism. Our malady is to think that we are exceptional when really we are alone. The imagination of our people in this country is so stunted that all we can imagine are dental visits for seniors and cheap eyeglasses for seniors. When just about everyone else on earth has world-class, excellent healthcare for much less, what do we demand? What can we imagine? Dental cleaning. Well, our job today is to open up people's imagination to what is possible and to what is our right. We are here, I'm not the first one to say this, speaking truth to power, because we know that power concedes nothing without a demand. And here are our demands. We have 3 non-negotiable demands. Healthcare is a human right. Say it after me. Healthcare is a human right.
Healthcare is a human right.
Thank you. Everybody in, nobody out.
Everybody in, nobody out.
Healthcare must be free from corporate profit.
Healthcare must be free from corporate profit.
Everybody in, nobody out.
Everybody in, nobody out.
Healthcare must be achieved through national legislation.
Healthcare must be achieved through national legislation.
Everybody in, nobody out.
Everybody in, nobody out.
Thank you.
Woo!